Well, after all those years in the public eye, he is not done just yet.
Wisconsin's longest-serving governor, Thompson, left that job to become Health and Human Services Secretary for the George W. Bush White House. He now has our nation's health on his mind with his latest mission.
And he joins us now in studio with more on exactly what that mission is. And Governor, thanks for being with us.
Welcome.
Great to see you.
Well, first off, let me just say thank you. You two individuals are as beautiful and as nice and as wonderful as I remember you. So thank you very much for having me on your program.
Governor, you're looking very good too. I remember being on the campaign trail with you and watching you do push-ups.
Still doing 100 a day?
Are you still doing 100 a day?
I do about 100 a day, yes. 50 I get up in the morning, do 50 in the morning, and then throughout the day I do another 50.
Now you're speaking about what you know about staying healthy.
Fit and being healthy.
I really believe very sincerely about the fact that we have to do something about health care. Truth of the matter is, we are not very healthy in America. And if we're going to ever get control of our health care costs, we got to start being healthy. We got to eat right, we got to exercise, and we got to do things that are going to be able to make sure that we do things to prevent chronic illnesses, because that's where 75% of the cost of health care is. And there's nothing, you know, food, clothing, whatever, doesn't even come anywhere near what the cost of health care does for us as Americans. And the next closest country is Germany. They spend 11%. So you compare 20% to 11%. China spends 3.5%. So we're way out there. And the reason we are is we don't take care of ourselves. We expect somehow that we're going to be able to become healthy by watching sports and watching television and eating fried foods. I tell people, you know, instead of having go out and doesn't mean you can't have your brats and your hot dogs and hamburgers, but instead of having 4 hamburgers, try one. Instead of 3 brats, just try one.
But there's a personal side, but you also believe strongly there's a policy side too, that the government plays a role in classifying obesity as a disease, covering it through Medicare. That's a big piece of it.
It's a big thing, and it's really a departure from what the modern thinking is. Or the modern thinking is to do that, to cover it. But up until now, everybody's shied away from this. Says, you know, if you're fat, it's your fault. But the truth of the matter is, you know, some people are going to be fat and they can't lose weight. They can't exercise, and because of their metabolism, because of their physical structure, because of a lot of circumstances, you know, they can't lose weight, and as a result of that, it costs the rest of us in America a lot of money, because obesity leads into chronic illnesses, which is 75% of the cost of health care. Now, wouldn't it be smart, you know, to do something to reduce that $200 billion, or 190 would be exact, which are obesity-related costs on our healthcare system? I say, let's spend a few $1,000s to reduce $200 billion.
Yeah, it makes a lot of sense.
That's the argument.
Yeah. Well, is this kind of what you want to be your mission? You head into the golden years and you're very fit, but you and Sue Ann have been so proactive in health issues. Sue Ann's fight with breast cancer, and so active in the community in that. Is that kind of your mission now to help fellow boomers stay healthy?
I really want to get the message out. You know, we're great people, and we've got a great state in Wisconsin. Why don't we just, you know, use our common sense? If I push myself away from the table, I tell people, you know something, you can load up all you want, but only eat half of it. Push away half, the 50% rule. If you do that, you're going to lose weight. And you make everybody happy, you lose weight, and you become healthier, and you save the taxpayers' money. I say
everybody wins.
That's a good deal.
Yeah.
Still got a lot of energy, doesn't it?
Yeah, it's so good. It's good to see you. You're as vital and feisty as ever, and I think a great cheerleader for this campaign.
Absolutely.
Well, I really want us. I want us to be happy in our golden years. I want everybody to be happy. The best way to be happy is what? Be healthy.
That's right.
Good to see you, Governor. Thank you so much for coming in today.
Thank you very much.
Thank you.
And we'll be right back with more in a moment.